A controversial study is sparking debate over stay-at-home measures during the pandemic. Good evening. I'm Kimberly Hunt in for Lindsay Pena.
And I'm Steve Atkinson. That study claims lockdowns in the U.S. and Europe only reduced COVID deaths by a fraction of a percent. It comes as the U.S. is now reporting 900,000 COVID deaths. Our ABC 10 News anchor Derek Stahl is going in depth with two experts who say the paper is seriously flawed.
The study comes from 3 economists, including one from Johns Hopkins University. They claim lockdowns had little to no effect on COVID-19 mortality, saying the measures only reduced COVID deaths in the U.S. and Europe by 0.2%. That conclusion has reverberated all over social media, but 2 experts told us it's not accurate.
Asking people to stay at home, limiting gathering, we saved a lot of lives. I have no doubt in my mind, and millions of lives were saved by these mandates.
I think it's just a real problem in these kinds of studies to accept them at face value until you go look under the hood.
UC San Diego's Dr. Robert Schooley says the first problem is their definition of a lockdown. The authors considered a lockdown to mean any mandate that directly restricts people's possibilities. So they counted all kinds of restrictions, from full-blown shelter-in-place orders to mask requirements to limits on gathering size and more.
Say restaurants must close at 10 o'clock. That hardly would be expected to have much of an impact on whether or not the virus is transmitted at 9:30. If you put all those studies together in one big bucket, those studies in which the lockdown was very mild would make it look like it didn't matter.
This paper is what's called a meta-analysis. The authors ran a big internet search on other academic research for things like COVID and deaths, and then they whittled down the results. Out of more than 18,000 studies, they based all their conclusions on 34 papers that met their criteria. The authors intentionally excluded papers written by epidemiologists in favor of ones written by economists or political scientists, arguing that these disciplines have more expertise in public policy.
To say that I don't trust it because an epidemiologist wrote it, and I really value what an economist writes, is really not what meta-analyses are about.
The Economist study also didn't take into account when governments enacted their lockdowns. University of Washington's Dr. Ali Mokdad says some states acted too late. Others announced lockdowns when people were already largely staying home, meaning the orders would have little impact.
To not account in your analysis for the impact of mandates on one indicator, say mobility in this case, you're going to do the analysis totally wrong. You're going to blame on mandates something that is not a mandate related.
Other studies have found stay-at-home orders saved millions of lives. And both of our experts say if you want evidence that lockdowns work, just look at China. It now has the lowest COVID death rate of any large nation. Derek Stahl, ABC 10 News.
Meta-analysis have been wrong before. A study that looked into the horse dewormer ivermectin as a possible COVID treatment was later retracted after researchers learned that some of the data was fake.